Hello and Assalamu alaikum. Ultrascan Diagnostics. Say this is the CBCT of the patient that you had requested. The area of interest is the lower premolar region where an implant has been placed. Now we can see very clearly on this view that the implant is very closely placed close to the mental foramen. On the transaxial view, you will be able to see a complete step-by-step guide as to how close it is to the nerve. This is the implant placed in the center of the ridge. Now we're going to move from the medial aspect towards the distal aspect. This is the moving towards the distal aspect. We can see that we're very closely associated with the nerve, closely impinging on the exit where the inferior alveolar nerve and the mental nerve comes in close to the contact. It's not in direct contact as you can see, but it definitely is very closely associated. We go to another view right here, and then you can see from the top of when we go deep, you can actually see that the inferior alveolar nerve and the implant come in very close association. We're going to zoom in for the doctor, and here you can see that we at this point right there is where we can see that the nerve is the closest. It's not, again, we'll reiterate, there is no exact direct contact, but at this point we can see right here where the mental foramen just comes in very close association to the implant right there. We'll show you another view. This is the sagittal view. Here also you will be able to see that at the mesial aspect of where the apex of the implant is, you can see that it does come in very close proximity. There's absolutely no distance. We're going to remove the nerve mapping for better understanding. Here you can see that there is slight bit of a um, radiolucency which destroys the canal cortical plate, and this is the only plate where the canal cortical plate is not continuous. Otherwise, the canal is uninterrupted by the implant. The other area where the complaint is the upper right molars. Um, So this is the upper right molar where we have a endodontic treatment done, no periapical radiolucency in the mesial, slight bit of a periapical radiolucency can be seen in the palatal, and then when we move towards the distobuccal root, again no radiolucency scheme. This decent endo has been done. This is the upper right 7, no periapical radiolucency or crown problems can be seen. No fractures or radiolucencies can be observed either. This could be the pain that the patient is commenting about, could be periodontal in nature. Clinical evaluation will be needed. This is the upper left molar, as you can see right here. This also has a prosthetic uh, covering over it. No radiolucencies, cracks, or J-shaped radiolucencies or fractures can be observed in this case. Thank you very much.